Friday. Y'all know in the nursing studio on Fridays we do Flashcard Fridays, but this Friday I'm going to do it a little bit differently, just simply because here in South Carolina they're forecasting snow, and y'all know that is nothing usual for us here. So of course school is being let out early, and so as I'm sitting in the car ride line to pick up our youngest two daughters, I figured let's do Flashcard Friday this way, so it will allow you to see the mobile function as well. Because honestly, this is why I did it in a digital format, because I get the busyness and having ways so that you can be intentional on still getting your studying done, no matter how you have to pivot. Because look, when I was reviewing, I would have the flashcards in my bag, or my notebook in my purse, so that I can study. So hopefully this is helpful for you guys, but let's get into it. And if I land on a term, then I want you just to tell me what it is. But okay, opacity of the lens of the eye, treatment is surgery. And I know y'all just saw that, but because I was explaining it that way, I'm going to go from this. But you should think cataracts. This is one of those things where I tell you to know the term, key identifiers, because when, you know my saying, when I say this, you say that. This is one of those things. When you hear or see opacity of the lens, you should think cataracts all day, every day. Otalgia, tympanic membrane is red and inflamed. Fever. Treatment, first line therapy is amoxicillin. Augmentin is your second line. Penicillin allergic. If they are penicillin allergic, you want to go with your azithromycin, which is your Z-Pack. And like you probably heard me talk about before with flashcards, if you look in the upper right hand corner, I will always have the system that we're in so that you know where it's going with. Okay, so you see EENT up there. But this is acute otitis media. And pay attention to terminology. Otitis media being that inner ear inflammation. So you're going to see that tympanic membrane being affected. Whereas with otitis externa, the tragus, the external portion of the ear, is where they have the issue. So tragal pain is the most common issue, okay? Let's see. Y'all, I'm trying to click fast and I'm hitting all kinds of stuff, aren't I? All right, so a white-gray ring around the cornea at the corneal margin. This is a sign of hyperlipidemia. You want to assess a lipid panel and treat. Treatment is to assess the lipid panel and treat accordingly. It's a normal finding if they are 60 years of age or older, but it's abnormal for the 40-year-olds and older. What are we thinking about? And this is in the EENT section. Arcus senilis. Something is blocking the conduction of sound to the middle or outer ear. Rhine results show bone conduction is greater than air conduction. Weber results, sound lateralizes to the affected ear. What are we thinking? Conductive hearing loss. And I have some medications in here too to help you with those areas we struggle with. Let's see. All right. Microcytic MCV is less than 80. Normal cytic, the MCV is 80 to 100. Macrocytic MCV greater than 100. Hypochromic MCHC less than 31. Normal chromic MCHC 31 to 37. Hyperchromic MCHC is greater than 37. And these are your anemia lab values. So some of these you'll notice that I inserted in this fashion so that you are able to review those. So that you can review those as a quick little study card. So some of them are just like a review and glance type thing. And then we go more into anemias. on those other ones that break down the specifics, right? All right, so an endocrine one. This is when the patient experiences hyperglycemia in the morning. This is usually early morning. The treatment is to monitor the blood glucose in the morning and at bedtime to rule out the Somogyi effect. We treat based on the patient's glucose in the morning, metformin or insulin dosing. And that would be your dawn phenomenon, right? Remembering that dawn phenomenon, I say think at the crack of dawn, it's before 8 a.m., typically like 3, 4 a.m. in the morning. They'll have hyperglycemia and there's no other related source. Whereas with Somogyi effect, they have nighttime hypoglycemia, which is why they have the early morning hyperglycemia, because as the body tries to compensate, there's a rebound effect that causes that early morning hyperglycemia. So with Somogyi, you want to treat that nighttime hypoglycemia and the early morning hyperglycemia will resolve. I'm going to do a couple of more and get off of here. Let's see. There is pain to the left lower quadrant due to inflamed intestines and diverticula. Diagnostic is the Ropsing sign. Treatment is Cipro, Flagyl, and or Bactrim. What do you think? Diverticulitis. All right, dermatology terms. Fluid field elevation that is less than 1 centimeter. Fluid field elevation less than 1 centimeter is a vesicle. And make sure you know these, because on test questions they can give you derm terms to describe things, and if you don't know what these terms mean, you can't visualize or even understand that they're telling you something was fluid field, right? Know your derm terms. All right, Christmas tree pattern rash on the trunk. The treatment is no treatment typically, as it usually resolves in 1 month. Pityriasis rosea, right? And let's see, one more. Located at the proximal interphalangeal joint from your nail. This is the second joint. Treatment, Tylenol first and then NSAIDs. It's located, and this is musculoskeletal, located at the proximal interphalangeal joint. What do you think? Bouchard's nose, right? BP, right? B for Bouchard's, P for proximal, whereas Herbert's is HD. H for Herbert's, D for distal. Another musculoskeletal. I know I said one more, y'all, but I'm still sitting. Card right on. Also referred to as tennis elbow pain to the outer portion of the also referred to as tennis elbow. Elbow pain to the outer portion of the elbow. Treatment is rest and NSAID. This is why punctuation is key, right? But also referred to as tennis elbow, period. Pain to the outer portion of the elbow. We treat with rest and NSAIDs. Which one is considered tennis elbow? It's the lateral epicondylitis, right? And remember, medial epicondylitis is considered a golfer's elbow. But I always say think of it like this, because when you're trying to picture it, it can get confusing if you look at it the wrong way. But lateral has a T and epicondylitis has a T. The one with the most T's is tennis elbow. All right. Men's health. Inflammation of the epididymis. This causes scrotal pain. Prince sign. When elevating the testicle, the patient's pain is relieved. Treatment is Rocephin or Doxy. What do y'all think? Epididymitis. All right, y'all. We'll do some more another time. It is starting to come down, so let me try to grab the crew, and y'all meet me back here next Friday for some more Flashcard Fridays. All right, bye, y'all.